Thank you all for joining us today for our Wave 3 technology migration conversation. We're really excited to have this open dialogue with you. We are using a Q&A throughout, so I would encourage you as our presenters are speaking, if there's something that's of interest to you or you want to dig a little deeper, we'll be monitoring the Q&A and we'll work to kind of pause the presentation and make sure we're addressing your questions throughout our conversation. So thank you all for joining us. I'd like to introduce our presenters for today. We have Megan McDermott, who leads our Integration and Transformation Office. We have Dr. Natasha Parekh, who's our Medical Director of the West Market. Rachel Goldman, who is our Senior Product Manager. Daniel Stafford, who is our SVP of the East Operating Group, and Kelly McNee, who leads our BI and Analytics team. Really excited to have this team of colleagues here with me to cover these agenda items. So we want to give you an overview of the integration, including kind of the change management process. As you know, we merged Marathon and Everside merged about a year ago. And so we've been working these past 12 months to prepare our teams for this really critical point of migrating systems. And so we're excited to share with you some details. We've already done 2 waves of migration, our results, and some lessons learned. But like we said, we want to make sure we're addressing your questions as well. We'll cover the clinical experience, the patient experience, and then the client experience, mainly tied to reporting and analytics. So as you know, we exist, our purpose, we coexist with you. We're in this partnership together, and our focus is to enable as many employees, spouses, and dependents to help them live the healthiest life possible, one patient at a time. It's so critical, those provider-patient interactions, because that's really what sparks change and transformation for an individual and taking steps to become a healthier person for their family, their friends, and certainly for how they show up at work as well. So now I'll turn it over to Megan. Thank you.
Thank you, Kate. As Katie shared, I'm Megan McDermott. I'm overseeing our integration process. And we really wanted to start with sharing a little bit about our Ignite ecosystem. So we speak about our technology system as Ignite. And this is built around kind of a purposeful built system that allows us to drive patient care in the best and most meaningful way possible. It brings together our clinical experience, our patient experience, and our enterprise data warehouse. So you'll hear more later about what Ignite is and more details around reporting and how we drive member communications. We really wanted to start with kind of framing that experience up as we jump into the integration. As we look forward, we also wanted to share a little bit on our structure of the Integration Management Office. We could jump forward. There we go. So here's the structure we put in place about a year ago, as Katie shared. So we built out a dedicated integration management office, and that was really taking from the learnings from both legacy organizations, looking at past M&A experience and deciding what was going to work best. And we knew we wanted to kind of drive this experience with our own teammates and really learn from the shared learnings from the past from legacy organizations and really build a structure that would allow us to efficiently kind of move through this integration and put our clients and patients first. So you can see here we're guided by our executive steering committee. We have a change management component, and then we worked on individual business work streams and have a dedicated focus on the wave migration. To look at some of our results on wave 1 and wave 2, as Katie said, we're approaching our 3rd wave, which is really exciting. So we've completed 2 large waves already in 2024. And you can see on this slide those high-level stats and kind of the size and scale that we've been able to support and work towards. A couple things to call out is we stand up a dedicated command center for our care team. So we know support of our care teams is critical so they can keep providing that best-in-class care to your patients. So our command center is supported for multiple weeks with a cross-functional team of technology and trainers, and from partners from Athena to really support us through that process. And we were able to drive an under 20-second response time to our clinicians. So when people needed urgent help, we were able to get that for them. So that was something we're really proud of. From a registration perspective, our marketing team has driven a really strong re-registration campaign. So a coming soon process that allowed us to get a quick readoption of members as they work through that transition of the patient portal. Additionally, we saw care teams closing 82% of their encounters, which is their clinical notes, within the same day, which really demonstrates kind of the ease of adoption through the process. While change is difficult, we have a really robust training program and make sure we're supporting them. And that same day note closure is actually higher than it was in the prior system. So we're really excited to continue to see our care teams get more efficient and really accelerate the time they can spend with patients. As we jump forward in the integration process, so we did a lot of initiation discovery in 2024 that allowed us to kind of hit this migration at an accelerated pace and get to one consolidated technology platform early in 2025, which was our kind of one of our guiding principles as we worked through this. We've been in the planning phase of like making sure we're building out clients and health centers and migrating technology and clinical data. So we've had so many inputs going into that, that we're excited to be at the kind of execution phase of wave 3. And I'm going to hand it over to Daniel to pick this up and talk a little bit more about the execution phase.
Thanks a lot, Megan. I appreciate it very much. Yeah, so we're at today. We're at the execution phase, getting really close. So what's going to happen next? Just so you're aware, in case you're not, February 11th is the target date for this migration to go live. So before that, exactly a week before that, may or may not be my birthday week. If you want to send me a card, that's great. But about a week before that, we're going to start patient communication. So your workforce is going to start to get emails, start to get information that says, hey, this is what you can expect from the technology migration. Once we get to February 11th, we're going to send additional information to remind patients, how do you access the new portal? How do you make appointments, et cetera? We've actually developed a pretty robust support program to make sure, it was pretty good in wave 1. It's amazing in wave 3, as we've learned from those first 2 times through. You've already got in your health center. If you haven't been in lately, I encourage you to make your appointment now, or certainly in the not too distant future, but you've seen table tents and signs and placards, things of that start talking about this migration months and months ago. And then your care teams are in the middle of training to make sure that they're ready to go. We've done a couple of things. We have super users that are helping to support them, in addition to the asynchronous training sessions that we've set up to make sure that everyone's ready to go on February 11th. And then a little bit of we use the word warranty period there under today. So we have a little bit of a warranty period as well, right? So we want to make sure that we have support after the fact. We've been pretty successful doing that as well. So excited about February 11th go live. So you may be asking questions around like data. What happens to it? Let's go to the next slide. And so we have 2 big buckets of data that we're working through. First is all the information you all or your advocates have been sending us, like eligibility files. What are the historical claims information we've gotten from your carrier? What have the HEDIS measures? What have our successes been closing gaps in care? As well as all the things that your provider and care team have been putting into the EMR, the EHR, the labs, your vitals, your immunizations, medications, all the things you see on the screen. All of that information is coming over, and we've tried to kind of create a funnel here into Ignite, which you heard Megan talk about that before. So that's a lot of disparate information. And so essentially we shove it in the big side of the funnel. We process it through our Ignite platform and dump it out into 3 major areas after quality assurance and validation. So first, clinical care delivery. We'll talk a little bit about the provider dashboard next. Personalized patient experience. We don't want you as a patient or any of your employees as patients to have to retrain your provider. So how do we make sure that we're personalizing patient journeys as well with that data? And then finally, providing you the analytics and reporting on success of the program, who's using it, why they're using it, where are areas of opportunity as we move into production. So yeah, so I promised I would share 3 different areas. For those of you that don't know, Gary Williams is on the call, and he's hassling me on the side over here by text messages, so I should have muted that, but hey, Gary. The 3 areas that we'll focus on are provider dashboard. So first, As that information gets jammed or mooshed, as Katie likes to say, in the big funnel, we want to make sure that we're providing actionable data at the point of care for the providers. So they're not having to look through pages and pages of information. They can look at their patients at a glance for the day and kind of be able to prepare and have the access at their fingertips to make quality decisions in a short time frame. Finally, your patients, your employees, your teammates, your associates are going to have access to the Marathon mobile app. If you haven't had a chance to download it yet, that's some of the stuff you're going to start getting pushed around my birthday, as I mentioned before, that first week of February. You'll start getting that pushed through to you to register for the app. Not only is it your historical information, it's educational, and it's so much more really than the app that they had before through Everside. I've been excited to work through that. And then finally, you as a client, through the dashboard. Kelly's on the call. She's going to do some more about that here in a little bit, but the data and access that you're going to have is going to be more than before, so it won't be less, which is really good news. So let's talk a little bit about what's changing and what's not. On the next slide. There we go. Perfect. What's not changing? Your care teams. They're not changing. We love them. You love them. It's fantastic. We're not taking away any products or services that you have. There may be opportunities as we get into the new ecosystem for us to use the information and Ignite, working with your advocates and determine if there's some additional services that may work, maybe not. So we'll talk about that down the road. We're not changing the way that you send us an eligibility file, and we're not changing your health center hours. That's awesome. What is changing to a degree is branding and signage. We're going to start sending out stuff from an app that says Marathon. If you still have Everside in the health centers, it may confuse patients. So we're going to start to, excuse me, we're going to continue that effort around branding and signage. We talked about technology platform, kind of all the way through. Hey, good news on incentive and wellness portal. We were working with a third party before. We're able to handle all that in-house now, which is a good thing. The next thing I want to talk about is a bit of an ask for you. So one of the things that changes is the email address. The emails are going to be coming from marathon.health. So your client success manager, your regional operations manager, if they haven't already worked with you, you'll be getting some information to make sure that we're whitelisted. The last thing we want is for all of our great information that we're sending to your employees to kind of go into your junk folders. We want to make sure that those messages are whitelisted. And then finally, client reporting is going to change again, not less. It should be as good or better for many of you. So we're excited about that. So then what's going to continue? We talked about what happens next after we've gotten past February 11th, and that is the Ignite reporting and patient experience. You're going to see that continue to be enhanced. The first report will be about 45 days post go live with the new data and the new Ignite platform. Incredibly excited to share that with you. We are going to be able to look at your core and add-on product set. As I mentioned before, maybe there are some opportunities to, now that we're into kind of the best of both worlds, the combined ecosystem, we'll be able to evaluate that core product set for you. And then finally, in some cases, if it's appropriate, if you have a large population spread across many states, we actually have a nationwide network of health centers that would be able to, that may be of use to your teammates that aren't at the home office, to be able to access, whether it be Charlotte or Indianapolis or Colorado, et cetera. We'll look forward to talking to you about that as well.
Hey, Daniel, we're going to hit pause real quick before we move to the next speaker. So I inadvertently said in the chat, use the chat for Q&A, but the chat's disabled. So please use the Q&A. Thank you, Emily, for typing a question here. There was a question about the recording. And yes, as a follow-up, anyone that received the invitation will get a link to the recording of this presentation. So thank you for asking that. Please keep those questions coming. We like to keep our presenters on their toes. So we'll move on to the next section. Thank you.
Well, I think that it's my time to hand the torch, as it were, to Dr. Parekh.
Thanks, Daniel. Thank you, everybody, for joining us today. My focus over the next 2 slides is really to kind of share the care team and provider experience with the migration and the change. So the next 2 slides are really going to largely focus on Athena as our electronic health record. So just to kind of build a foundation around what an electronic health record is, that is kind of the way that we as care teams and providers really interact with healthcare in many different ways. It's how we document our notes. It's how we request and refills for medications, the way we see labs and be able to share our lab results with our patients, et cetera. So kind of a lot of our experience with this migration is actually based off of the change in the migration to Athena. I've lived through many EHRs in my career. Most recently, I came from about 14 years of Epic as my electronic health record, and changed to Athena about a year and a half ago when I joined the organization. I will say, as a primary care provider and as a primary care kind of team member, Athena is made for primary care. It's much easier, a lot less documentation burden, much more efficient in terms of workflows. And we've heard just really wonderful feedback from our teams of overall kind of efficiencies with the change in EHR. So that's kind of a background on our electronic health record. In terms of kind of setting our teams up for success with the EHR change, as Daniel mentioned, first and foremost is really prioritizing training, ensuring that our teams have the ability to complete their training with their schedules. And that training includes asynchronous modules, as well as kind of live sessions, walking through patient cases, walking through patient scenarios, as well as kind of office hours and support. In addition to that, we have a very robust Athena Champion and Super User program. So what this means is this includes our Legacy Marathon care team members who have been used to working in Athena and are considered to be Athena experts in their own rights, as well as folks who had been in the previous waves who feel very comfortable with Athena. So this group of people really are meant to be kind of hands-on and close support to those folks who are migrating in wave 3. Our integration office has done a wonderful job matching kind of the people going through the wave migration with providers and care team members with their role, who can really help them through the process, be available for questions, walk through workflows, et cetera. In addition, so Athena has some really wonderful functionality around workflows and templates, where providers and care team members can create their own personalized templates to make life easier and more kind of consistent in terms of their care they're delivering for visits. But in addition to that, we as a clinical leadership team have also helped develop kind of encounter plans and templates to really promote kind of consistent care, as well as promotion of evidence-based guidelines in the care that we're providing through Athena, and really kind of helping make that available for our care teams across the country, so that, again, making life easier for them, but also promoting evidence-based care and guidelines through our electronic health record. And then the last point I wanted to highlight is our data migration and kind of efforts around ensuring that the data from ECW, the previous electronic health record, migrates into Athena in a more seamless, smooth fashion. And so there's been a lot of intent around ensuring that data are migrated into the right fields, and that we can kind of compare trends, et cetera, more easily for our care teams, and kind of intent with our clinical teammates and clinical leadership team to really be a part of the validation process to ensure that kind of data are flowing accurately and seamlessly. On the right side, we have some quotes from some providers who have migrated electronic health records recently. The first one is fun because it's actually a quote we hear a lot, which is, "Documenting is the least favorite chore of the job, but Athena's workflow makes life more efficient." The second provider really goes into Athena's ability to share really actionable information in easy views in terms of labs, vitals, et cetera, and as well as kind of the efficiency tools to, again, make life easier for our providers and care teams through and reducing documentation burden through their use of Athena.
Hey, Dr.
On the next, yeah.
Parekh, I think we want to pause real quick
Sure.
and work to address Aaron's question here, because it's a component of that you covered about the data migration of medical records. So the question is there a timeline for migration completion for this wave? Specifically, when will patients be able to see their labs, meds, et cetera, in the patient portal? So Megan, maybe I'll have you address that question for us.
Yes, thanks, Katie, and it's a great question. So how we approach clinical data was we actually migrated all patients. So regardless of wave, we've been migrating patient data. So what I can tell you that means is for wave 3, there is already clinical data that's been migrated to different segments, right? Because we're essentially doing catch-up data files. That was a change we made through the migration process from prior experiences to make sure we had the most data available to clinicians real time. So as of today, there is data from 8/28 for all wave 3 patients. By the time of wave 3 date, we will have data through 11/4, and then we will do a catch-up, the final catch-up for wave 3 about 45 days post the wave 3 date. So in early March, we'll have that catch-up file. There's some tools we've done to make sure that care teams kind of have everything they need and to make sure we're supporting patient care. So first thing is that their access to the prior system is not being turned off, right? We know continuity of care, patient safety is our top priority, and making sure we can treat that patient. We've also created kind of alerts that are available, like chart alerts that we set up for care teams. So it will indicate if a patient's had a visit that was after 11/4, which essentially tells them like, you need to go pivot and you need to go look. So that's the approach we've taken. From a patient portal perspective, all of their vitals and RX history will be loaded at the same kind of date range. So when we update Athena is when it shows up for in the patient portal too. Katie, did I cover all the segments of that question?
Yes, I believe so.
Okay.
And I do think, Megan, if we need, I think we have like a chart that shows all of those components. So Erin, we will work to get you that as a follow-up as well. Thanks for the detailed question. All right, Dr. Parekh, I'll let you keep going.
Sounds great. And just to share a little bit more about Athena as our electronic health record, I mentioned, and we shared quotes around Athena just being having a more efficient, intuitive workflow for our providers and our care teams, really kind of reducing that documentation burden or reducing kind of the drowning in charts that you can kind of sometimes see with providers to make sure that we are actually kind of spending more time face-to-face with our patients. A few other items to highlight about Athena. One is our advanced connectivity. So Athena is connected to information exchanges across the country. We have access to over 100,000 health systems, individual providers, and specialty clinics records. And so what that means is as a care team, we have a more comprehensive view of our patients because we're able to see the care that they receive beyond our walls, as well as their historical care. And that really helps to reduce kind of unnecessary testing, unnecessary referrals, because we have kind of a fuller picture and a more comprehensive picture of our patients. The last point I would like to make about Athena is that it really does kind of feed actionable data in a much easier way. You can see some screenshots here on the right where you have kind of your problem list, allergies, vaccines, medications, all kind of listed in the same place. The other part is our care gap alerts are actually very visible. And so for this particular patient, you can see they're due for a number of different screenings based off of this patient's kind of demographics and diagnoses, age, etc. And in Athena, in addition to being able to see those quality measure gaps, we're actually able to satisfy them quite easily through just clicking on any of these. So really kind of having as much as we can through snapshots in real time with our electronic health record. All right, I am going to hand the mic to Rachel Goldman, who's going to share a little bit more about our patient experience.
All right, perfect. Thanks, Dr. Parekh. So like Dr. Parekh said, now we're going to jump into the patient side of things. So we'll talk about the updates that patients can expect as they transition on to Marathon's Ignite technology stack. So we already mentioned the new name and the new brand that's being introduced, but with that, like we've talked about, comes a new patient portal and mobile app. So all patients will need to activate their portal accounts and download a new mobile app from the appropriate app store. So we do have both iOS and Android apps available. And I do want to mention, right, account activation was something we saw really great success with right out of the gate for patients in our previous 2 migration waves. So Megan touched on that a little bit earlier, but we do now have over 47,000 Everside patients that have successfully registered on the Marathon portal. So that's about 36% of patients that were previously registered on the Everside side that have reactivated those Marathon accounts. And those numbers are really going up every single day. So once patients go ahead and activate that new portal account, they'll start to see that historical appointment and health data that's been migrated over already in their record, with additional data populating kind of on that timeline that Megan talked about. And all the things that patients could do in their Everside accounts, like self-scheduling appointments, requesting medication refills, sending secure messages, viewing their health records, that's all going to be exactly the same. They can do all of those things in the Marathon Health portal as well. But they will also have kind of immediate access to a number of new enhancements that we're really excited about. So some of those new features include things like the ability to complete their intake and consent forms digitally ahead of their appointment, and that can be done in both English and Spanish. Patients will have access to expanded wellness capabilities, so they'll be able to manage incentives, participate in challenges, and sync third-party fitness devices directly with their Marathon portal accounts. And then the health records that they have will be a little bit more robust and more detailed than what they had on the Everside portal side. So all health records are now going to include a health risk assessment questionnaire that patients can complete ahead of their visit to help guide conversations with their providers. So that's kind of what's new, right? But in addition to some of those updates, there's also a lot of stuff that's staying the same, staying status quo. So all patients will still be asked to complete satisfaction surveys after their visits. Those will be delivered via email or on an iPad in the health center moving forward. And we are looking to add SMS delivery later this year. And just like registration, we also saw really great success with NPS scores after those first 2 migration waves. So our NPS is at an 89 for all of our migrated health centers in waves 1 and 2, which is really on par with what it was at in the legacy Everside world. So kind of staying the same, if not improving. And last but not least, I do want to mention, all of our patients are going to get and should expect the same level of care and attention, right, from our care teams that they got before. So none of that is changing as part of this migration process.
Hey, Rachel, if I know HR leaders, they're all really excited and they may try to go register right now. Is that okay? What would happen if they do that now versus waiting until closer to the migration?
Yeah, so we do want you to wait. What's going to happen is the Everside portal and app on the day of migration is going to be set up to automatically redirect patients over to the Marathon portal. So if you try to sign into your existing Everside portal come migration day, you'll automatically be moved over and kind of brought through the registration process on the Marathon side. You could register early, but you're not really going to be able to do anything. You can't schedule appointments yet. None of that's being flipped on until the day of migration. So it's really keep using the tools that you have available to you right now. And then as part of the communication process that I'll talk about shortly here, we'll talk through when we're going to ask patients to start creating their new accounts. Awesome. All right, so now we'll look at kind of how we're notifying patients about all these changes that we're talking about. So we do have a multi-channel communication approach that we're taking here, and that includes sending direct messages to our patients. We're going to use both email and SMS to do that. We are adding messages across the current Everside portal and app, like I just said, and our client splash pages as well, announcing the migration. We do have flyers and other materials that we're making available to be placed in our health centers. And then lastly, we do have some additional resources, so digital slides, things of that nature, that clients can use to educate their employees and members about what's to come. And this approach to communication will continue on an ongoing basis after migration. So it's kind of our take at our standard communications and engagement strategy. Dates are probably what everyone is most eager to see, so we'll talk about that timeline now. We did already start sharing news about the merger and our name change through kind of those channels we just looked at. But today, January 14th, is the day that Go Live kits will be sent to all health centers to help prepare for the migration. And then on January 28th, a Now Marathon marketing kit will be shared with everyone. And on February 4th is the day that patients will receive their first message, and that's going to be a coming soon message sent via email and text message that kind of just reminds them that the migration is forthcoming and with some information about what to expect. Then on February 7th, so starting on the 7th, patients that have appointments scheduled immediately post-migration, so kind of those 2 to 3 days immediately after the migration, they're going to get some personalized outreach from our care teams with instructions to activate their new portal account starting on the 7th. And really the goal is just to make sure that those patients on those first few days are prepared for the visit so we can kind of run as efficiently as possible. And then the day of migration, February 11th, is when everybody else, all eligible patients, will get messages prompting them to activate their new portal accounts. And that's also the day that client splash pages will be redirected. So then after the migration is complete, all of our patients will get added into our standard digital journeys, and they'll continue to receive reminders to activate their new portal app account if they haven't done so already.
Hey,
And-
Rachel, before we jump from there, sorry, there's a question about home mailers. Are there any home mailers tied to the migration?
I believe there are some mailers that are going out. Yes, I can get the dates on that if we need to add that in.
Yeah, or David, Daniel, let's have the account team follow up directly with David as well. And then there's a question about, will go live kits also be sent to the employer vendor manager?
You know what, Katie, I don't know the answer to that one myself, but we can certainly get kits, I'm sure, if need be, and talk to our marketing counterparts to make sure that everybody has what they need. I know they're definitely going out to clients, but we can confirm on the vendor manager side.
Yeah, maybe Daniel, if you could take that one as a follow-up too. You're getting a lot of jobs to do today. It's great.
I'm really glad to be here. I'm really glad to be here.
Extra birthday presents, early birthday presents.
That's right. I'll regret that later. I can already tell.
All right, I think the next thing we have here is just a short kind of recorded demo that's going to walk through some of those new features I talked about in our portal. Today we're going to walk through a short demo of Marathon Health's web-based patient portal. So as a reminder, this tool is mobile responsive. So what that means is it does flex to fit the size of the device screen that a patient's using. And then all the functionality that we walk through today, similar functionality is also available within our native iOS and Android mobile applications. So we'll get started with the registration process. Patients are going to land on this page here after they click the link in their communications that they receive, and they're going to be prompted to click this Register My Account button to create a new account. They're going to be asked to complete this short form to share some basic demographic information with us, so name, address, phone number. And then when they hit submit, we're going to match their information to a user record in our system that's been received through our eligibility file process. After that, assuming we make a match successfully, patients will be asked to create a username and password. And once that's done, they'll be all set to use their new Marathon Health portal account. So they'll automatically be pushed into their account. So they'll land on this screen that you see right here. And you can see right off the bat that all of the same features and functionality from the Everside portal are present in Marathon's portal as well. So patients will be able to schedule appointments, they'll be able to refill medications, send messages or communicate securely with their care teams, and then view their health records. So I'm going to spend some time highlighting the new features that will be available to patients as well through Marathon Health's portal account. So we'll start with the scheduling experience. Within here, patients will be able to schedule appointments for themselves as well as any linked members of their household. So for our patient Beverly, she can select to schedule for herself or for her son Billy. To schedule an appointment, she can either select a visit reason from the common visit reason list you see here, or she can use the type ahead search to find what she's looking for. So today she's going to schedule a 6-symptom visit. She's then going to be asked if she wants that visit to be done in person or virtually. When she hits search availability, Beverly can use the calendar on the right-hand side to navigate to the day that makes sense for her. So she's going to select an 8 a.m. appointment on October 1st. She can confirm her details, add any relevant notes, and then hit confirm and schedule appointment. The medication refill experience is very similar to the existing Everside portal experience. We won't spend much time here. Refills can be requested for the patient as well as any linked members of their household again. Messaging is also very similar, so patients can send messages for themselves as well as on behalf of a child or dependent. They'll be able to select a message reason from the drop-down menu here. Items like general inquiries, incentive-related questions, medical record requests are going to be sent to our centralized patient support team. And then things like general medical questions will be sent to providers in the health center. So patients can type in their message and hit send. We will spend a little bit more time in health records. The health records that patients will have access to through the Marathon Health Portal are a little bit more detailed and robust than what existed on the Everside Health Portal. So over time, as information is migrated into the Athena EMR system, all past historical data will also be visible for patients in their portal as well. So the first tab of the My Health dashboard here will show patients their biometric information. They can graph this to show results over time. Test results tab is going to show them past lab results. Within their health summary, they can view medications, allergies, health issues or problems, past immunizations, screenings, visit summaries, and they can print full visit summaries, patient education, and documents that have been shared by their provider. Each patient is going to have a customized risk profile compiled for them. They'll have goals that they can track that have been established in conjunction with their Marathon Health provider or health coach. And then they'll also have a view of current care guidelines that are recommended based on their conditions, their age, and other factors that they may have. And then last but not least is the questionnaires tab. So within this section is where Marathon Health risk assessment lives. This is often included in incentive programs, which is what's indicated by this trophy icon here. So this short questionnaire patients can fill out, takes anywhere from 5 to 10 minutes to complete. Previously, I did mention some additional incentive and wellness capabilities that will be available to all patients within the Marathon Health Portal. So if patients are eligible to participate in an incentive program, they'll be able to see at a glance their status here. They can view additional details of their program, and programs are fully customizable with the assistance of a subject matter expert from our incentive services team. Patients have the ability to participate in wellness challenges. They can come here to track their progress. And then they also have wellness logs where they can input and track data related to fitness, weight, steps, sleep, and water. We offer the ability for patients to connect third-party fitness devices, so this data flows in automatically. So patients can sync Fitbit, Garmin, Strava, Apple Health, or Google Fit accounts. And then lastly, we do have some new additional wellness resources that are available to all patients within the Marathon Health Portal. So patients will have access to HealthWise, which is a knowledge base of thousands of articles and videos on a variety of health topics. They'll have access to wellness workshops, which are designed by our own in-house Marathon Health clinical teams and provide some additional guided learning on common wellness topics. And then they'll also have access to Find Help, which is a free third-party tool, which will enable patients to find local community resources for things like food, transportation, or housing assistance. And our providers have access to this same tool through the Athena EMR. So as you can see, Marathon's patient portal is very easy to navigate, and it contains all of the features that patients are familiar with from their Everside portal accounts, plus a number of new additional features that we just reviewed. We're really excited for all of the existing Everside Health patients to experience this updated tool as they migrate over onto our Ignite platform. All right, and I see there was one question that came in while we were playing the recording here, so I will answer that. David, you asked, after the first time logging in, into the new app, will members get a tour of the site? So the answer to that is yes. So immediately after patients register or create their new Marathon Health Portal account, they're asked to agree to some short agreements, our terms of use, our privacy policy, and then immediately they are launched into what we call our onboarding tour, which is a series of 5 or 6 kind of little modals that pop up step by step that kind of walks patients through the major features and functionality that the portal and the app have to offer. So it gives them kind of a quick download and a how-to of how to use the system.
Modal is a fancy word. Is that just like a quick vignette or a video? Is that what a modal is?
Yeah, essentially just a pop-up. That's maybe layman's terms for it.
Okay. Thank you. Appreciate that. Great overview and demo. Let's see, we got one more question. How will you be handling connecting accounts that aren't mapped to historical accounts initially?
So if I'm interpreting that correctly, if patients don't have or were never registered for a portal or app account on the Everside side, then when they create their Marathon account, it'll be a brand new experience for them. However, if they have been seen by our providers and there is data on these patients within our EMR that's been migrated over to Athena, they will still see kind of past lab results, test results, etc. So same idea. It's basically any information we have on that patient in their chart in our EMR gets presented to the patient in the portal after they've created an account.
And now I'm going to talk a little bit about reporting and what you'll be able to expect going forward on the Marathon Health reporting tech stack. So I think what's important to kind of think about is some of the common themes we've been hearing today is that the two legacy organizations really were incredibly similar in so many ways, and reporting is not an exception. So when we've looked at the reporting capabilities between the two organizations over the past year, we really see, a 75 to 80% crossover in terms of the reports that have historically been delivered to our clients. And we have been working over the last year or so to kind of fill that last gap in order for you to see no gaps in your reporting capabilities within your migration to the Ignite tech stack. So it might look a little bit different, colors, layout, and everything, but really the way in which we define metrics will stay really similar, and the way we deliver those insights will stay the same. So when we look at the core components of how we show value across our business and the value of an advanced primary care model, we can really break it down into 4 kind of big categories, right? Are they using the health center? Do they love their experience? Are they engaged? Are they improving their health, making progress? And are we saving them money? And so these next few slides will kind of dive a little bit deeper into those 4 categories and just give a couple quick examples of what you might be able to expect going forward. So when we look at health center utilization, this is really the operational reporting that's going to be really key for you to get on a monthly basis, right? This is how many visits happened, when are the visits happening, what day of the week, what hour of the day is important, the visit frequency, so are people coming back multiple times, what are the top appointment types, and then looking at cancellation and no-show rates are also really key operational metrics that we're able to track on a monthly basis, just to really get you the full picture of how the health center or health centers are working and achieving those kind of goals. Engagement is a really key metric that we report out on a monthly basis, right? So this is the key pillar that drives by improvement in health outcomes, which then kind of drives financial outcomes, right? So engaging people, we can look at it multiple different ways, right? Our standard definition of engagement is looking at any visit in the last 18 months, but our standard reporting has the flexibility to tailor that to your needs. So if you prefer a 12-month look back, we can accommodate that. Looking kind of more granularly and looking at how many new patients are engaging on a monthly basis. And then on the flip side, how many patients are rolling off your look back period. So how many patients do we need to continue to re-engage on a monthly basis? Looking at kind of key demographic information for both your engaged and your unengaged population is really important. So we can drive kind of strategies in going forward and how we can target that unengaged population. Are they mostly male, female? Are they older, younger? Those kinds of insights really help us drive outreach and engagement strategy going forward. patient experience goes without saying. So Rachel talked a little bit about how after every visit, our patients get a survey and we report out on all that data that we get. So things like just, are they satisfied with their visit? Net Promoter Score, which is, are they likely to recommend the Marathon Health Services to a friend? But then also kind of more granular information, like were they able to schedule at their preferred time, right? That gives us an indicator of, do we have the right hours available for your population? Did they wait in the waiting room for more than 5 minutes, right? All those kinds of really key metrics that allow us to differentiate ourselves from, what's out in the community is something we report out on a monthly basis. Health improvement also goes without saying, right? We want people to come in, and people have a great time, but we want people to improve. So looking at things like biometric improvement. So are people who are coming in, is their blood pressure getting better? Is their BMI getting lower? Prevalence of chronic conditions within your population, which again allows us to drive programming and strategy. If you have a high diabetic population in your community, that's using that reporting to kind of drive that strategy is really important. Additionally, looking at care gaps and looking at those people who are due for cancer screenings compared to HEDIS benchmarks is really important. That kind of drives, again, the next slide when we go into kind of financial outcomes is, thank you. Looking at, are we saving money, right? So are they engaging? Are they getting better? And are we saving them money, right? We want people healthier so that they're less costly, but they also cost you less money, right? And there's sort of a couple different ways we can look at that, really big picture, 30,000-foot level, looking at a trend analysis using claims, looking at a more cohort-based analysis, looking at engaged population versus non-engaged population, right? Combining claims data with our EMR data. And then looking at a non-claims-based methodology of, what would you have saved because you have so many same-day, next-day appointments? What's your referral avoidance burden, and how does that diverted care kind of save you money? So there's a lot of different ways we can look at financial results, all which are available to you when you migrate to the Ignite tech stack. These last two slides are just going to talk really quickly. So monthly reporting, this is going to be delivered to you by your client success manager on a monthly basis. We have a really great comprehensive standard reporting package that kind of bundles all of these really key metrics into one really succinct, easy to digest report, right? So all those things I just talked about, volume, engagement, satisfaction, chronic disease prevalence, all of those kind of metrics bundled into one report delivered to you monthly so you can keep an eye on how things are going. And then on a monthly basis, right, we're going to take the data and really dive a lot deeper. Look back on the year and see what was a success. Look back on the year and see, where are there opportunities for the future to drive more strategy? Where could we have done better? Where's there, again, opportunities to success? So that is a more intense, comprehensive drill down into your data on an annual basis that will be delivered to you by my team, our business intelligence team, as well as your client success manager.
My goodness, we covered a lot. I'm trying to think of other questions that we've gotten through our different webinars, and maybe I'll just ask a few here and then send everyone on their way today. Thank you, Suzanne. She commented that it looks like a great platform. I love that and would really encourage you all to become early adopters. I think it's really important to help lead this change for your employees and your teams. And so registering on that first day, February 11th, as we learned that Rachel said, making sure you're adapting the platform and know how to schedule and use the technology is always a great first step. So one of the questions we've frequently get is, will patients have to create a new portal account or download an app? And so Rachel, I think we heard Yes, all of the above. And they'll be triggered to do that on day one. Our job continuously post day one will be to drive communications and campaigns to encourage registration, engagement, or re-engagement. But we really, in our health center teams too, will work to get patients re-registered in that portal. Kelly, I don't think we hit on this, but there's this question. So you migrate on February 11th. When would a client be able to get a full month of reporting or utilization from post February 11th migration date?
Yeah, that's a good question, Katie. So we have made an internal and an external deadline to deliver reporting 45 days post-migration. So 45 days, you will be able to get that full reporting package that I just reviewed with all historical trending data in there. And that should be delivered to you, right? 45 days or therefore they're around, right? Whenever we usually get your reporting.
Got it. And then Megan, I think you hit on this, but we want to assure people that any medical record data that was in Everside's eClinicalWorks or Warehouse that is coming over to the Marathon data set, correct?
So discrete data is being migrated in discrete fields, like unstructured data is also being migrated as part of the clinical data migration process.
Yes. And then Daniel, you touched on this, but when would a health center be rebranded to the Marathon brand? Is that immediately, or is that kind of an ongoing process that we've been following?
I felt like you were leading the witness a little bit. So it is an ongoing process. So your client success manager, regional operations manager will keep you posted on kind of where you fall in that. But we are trying to get those done as quickly as is reasonable, but in a thoughtful way.
Got it. And there was one other question that I know we've gotten about Spanish translations. Rachel, do you want to tackle that for us?
Yeah, absolutely. So I did mention the kind of consent forms and intake process that we ask patients to go through ahead of a scheduled appointment. All of that can be done in Spanish as well as English, and they also can get appointment reminder text messages and emails in Spanish as long as we have patient's primary language documented correctly in our system, which our teams work really hard to do. In terms of the patient portal and the mobile app today, those are in English only, though we are planning to have Spanish translation available before the end of this year. It is kind of a P1 initiative for our organization for 2025, which is really, really exciting. But I will say one thing that patients can do in the interim that I typically recommend is use browser-related translation tools if they're opening the portal in a web browser. It works super well, and they can use that for languages beyond Spanish as well.
I love that. Thank you. Dr. Parekh, you came off mute. Anything to add?
I did. I do have something to add in terms of Spanish translation services, like during clinical encounters and visits. We also have translation services through Marty. Some of our centers provide care in 26 languages, which is incredible. And their translation services are solid. We're able to use them from the perspective of translating, but also understanding kind of some of the cultural nuances of communicating and kind of health literacy as well, in terms of kind of the value of their translation services. So I think that's kind of the full kind of patient experience around translation.
Yes, one more question here, Megan. So just to clarify, all historical medical information should be migrated by how many months?
So at time of migration for these clients in wave 3, there will be a lag of data. So essentially within Athena and the patient portal, there'll be a gap of data from 11/4 to date of migration. And then we will be doing a catch-up file. So the QA cycle on that from the time of we extract the data, do all the QA, do all the mapping, do the clinical validation of it, and comparison between the systems has, it takes, the cycle time takes that long to go through all those validation processes. That's why we see a lag. But the clinicians will continue to have access to the data and a complete record for the patients.
Got it. And then this question around my medications migrating.
Yep, so medications are migrating. I think the question specifically is around the patient portal. And for prior waves, medications did not show as visible to the patient. So essentially in that refill option, they had an area to free text. We are actively releasing a release to change that code, and we've resolved that, and that will be released by the time of wave 3. So Aaron, you're not wrong if you heard that, and that's an improvement our dev team's been working really hard on because we know it's really important from a patient experience perspective.
Awesome. We covered a lot. So thank you all for joining today. We're really excited as we work towards this February 11th date. We'll continue to be in touch with you through your account team, and we're just grateful for your partnership and our shared purpose to change lives one patient at a time. So have a great Tuesday, and I'm sure we'll be in touch. Take care.